Welcome, everyone. Thank you so much for making time to join us today. My name is Dina Marr. I'm a Regional Outreach Coordinator with the Community Partner Outreach Program. And today we are doing our monthly webinar module series on public charge updates with the Oregon Law Center. Just a few housekeeping things. If you have questions, feel free to put them in the questions box. But there will be time throughout the presentation and at the end of the presentation as well for you to ask any questions. Again, this module is being recorded and all information will be sent in a follow-up email to include the slides in PDF format, as well as YouTube video recording links and any applicable handouts. Our Spanish session will be at 1 p.m. today, and the same applies to that for follow-up materials. And I have my colleague Denise with me. Denise, do you want to introduce yourself?
Yes, thank you. My name is Denise Pisa. I'm one of the regional outreach coordinators, and I serve the Willamette Valley. And so I'll be here supporting with the tech stuff, with the presentation, and just really happy to be here with everyone and happy to have Beth with us.
Awesome, thank you, Denise. And Beth, if you want to go ahead and introduce yourself.
Sure, thank you so much, Denise and Dina. Welcome everyone. Thanks for joining this session today. My name's Beth Englander, and I am an attorney at the Oregon Law Center. I work in the statewide support unit office of the Oregon Law Center, and that means that I work with lawyers throughout the whole state of Oregon who work for both Oregon Law Center and Legal Aid. Anytime there's a case about public benefits, and that is kind of a broad area, but and I'm so happy to be here talking to you today about we're talking today about public benefits that are available to immigrants, what they are and why people should get them. And we're also going to share really good news about public charge. And that good news is that the public charge rule has gone back to being extremely limited. And we're going to get into the details of that. But I do want to share with you that at Oregon Law Center and Legal Aid, we are really trying to shift our focus when we talk to immigrant communities throughout the state. We're trying very hard to reduce people's fear about public charge and try to really limit people's fear now that the rules have changed, and at the same time increase immigrants' confidence in the safety of getting public benefits. And at the same time, we are looking to kind of reduce any stigma that immigrant communities may feel exist about getting public benefits. And also some of the mystery about who qualifies and who doesn't qualify. So with that, that's sort of our focus, and we would love for you're all so important throughout the state of Oregon, and in obviously talking to people about the Oregon Health Plan and health benefits, but I know that you're trusted community resources wherever you are in the state of Oregon. And so any help that you can provide in spreading these same messages could go really far in helping our immigrant communities in the state of Oregon to just be safer and healthier and more stable. So, and I do want to also say we're looking for your feedback on this presentation. So feel free to put it in the chat or contact me afterwards. However you want to give your feedback on what messages we're using that really resonate with you, or what things you found confusing, what things you found particularly helpful. We'd be I would love to hear that. It'd be really helpful to us. Okay, so we're going to go to the next slide. I'm going to turn my camera off so you all can see the slides better, but I'll turn them back on for questions. So if you could advance to the next slide, that'd be great. Thank you. Yeah, so here's what our objectives for today. We're reviewing, we're going to give you updates on the public charge law, who does the law apply to, and then what programs and benefits fall under the public charge law. And then we'll also have time for questions. Next slide, please. So this is just, like I said, we're shifting our focus, and we're really talking when we talk to immigrants about support for everyone. So that's That's the message that we're trying to get across, is that public benefits for immigrants, and we're going to talk about update on public charge rules. So next slide, please. This is actually just a reminder for everyone. Most of you may already know this, but in case you don't, both Oregon Law Center and Legal Aid Services of Oregon, we have offices throughout the state of Oregon, and we cover every single county in the state except except for Jackson County. Jackson County has its own legal aid program called Center for Nonprofit Legal Services. But I wanted to make sure everyone knows that your clients, people you see, can get free legal help on the issues that on civil legal issues. That's what we help with. So we don't do criminal law, but we help people with housing issues and evictions. We help people with family law cases, employment cases, including farm worker rights. And we help people with all kinds of public benefit issues like the Oregon Health Plan, any kind of health care, food benefits like food stamps and SNAP, TANF, unemployment benefits, Social Security, long-term care. We help people with lots of things. So each office has its own local phone number, and those phone numbers are easy to find online. We also have a statewide hotline that is just for public benefits questions, and the number is right there. It's 1-800-520-5292. It's usually open, the hotline's usually open Monday through Thursday. So feel free to refer people who have questions about public benefits and public charge to that line. Okay, next slide, please. I want to remind everyone, I'm looking forward to answering your questions and talking about the issues we're raising in this presentation. But just a reminder that this is a public space, so as much as we love to hear from you, I really want to hear from you, we do need to keep questions general in this forum because there's no attorney-client privilege. This isn't a private conversation. So so if you or on behalf of someone you work with need individual legal advice, then I would really recommend you reach out to one of the Legal Aid or Oregon Law Center offices or the hotline and make make an appointment or get individualized legal advice, because we can't get that detailed level of advice here in a public webinar. All right, next slide, please. Okay, this is a little hard to do on GoToWebinar. But I like to start out this presentation just asking people what have they been hearing about getting help and getting public benefits, especially immigrants, and what have people heard about how getting public benefits might affect their immigration status? If anyone wants to type something into the chat function here. This is easier on Zoom because I can see it, but I can't see yours right now.
So if anybody wants to answer, or if you have an answer to this, you can go ahead and enter it in the questions box, and we'll make sure to read it out to Beth.
Anything coming in, Denise, or?
Not yet.
Okay, that's okay. So I'll just remind you that this is something I'm sure you're already thinking about, but immigrants are worried right now. They're worried about getting public benefits. They're worried it might impact their immigration status. Not that many people are using the words public charge necessarily, but people have this generalized fear of, if I get help, if I get support, it might come back to bite me. It might hurt my immigration status in the long run. And we want people to worry much less about that. And so, and we're going to talk about the reasons they can worry less about that today.
And Beth,
we do have some comments right now. So
yeah, let's hear them.
We have a comment that DACA members have been advised by their immigration attorney not to apply for public benefits. Someone else mentioned that they've had quite a few individuals cancel their benefits for fear of changes in the times to come. Somebody else mentioned their attorney told them not to apply for benefits. Some mixed immigration status households have canceled their OHP coverage. If a parent is not on OHP, but their child is, do they still qualify for free legal counsel?
Well, let me address that one first, actually. I'm so sorry I didn't make this clear. So we, yes, Oregon Law Center does not, we don't have any immigration status requirements at all to help people. Some legal aid offices do, but they will tell someone, they can give anyone some general advice. If someone needs individualized representation, a legal aid office will refer a client to an Oregon Law Center office for help. So nobody should worry about that if they want to reach out for help to Oregon Law Center and legal aid. So the things you just read out, Denise, those are all like, yeah, that's what people are hearing. Sometimes they're getting not great advice from people who maybe don't know all the details about public charge, or just don't want to think that people shouldn't take any risk at all. That's why this message that we're going to go through today about how few people need to worry about public charge is so important. And the more that you can share that with the communities that you work with, the better. You know, like you, I just feel devastated when I hear that, you know, people are canceling their Oregon Health Plan benefits because they're afraid it might impact them. When I mean, there are so few, there's there's almost no possibility that getting Oregon Health Plan benefits could hurt somebody, especially right now. So, but yes, those are the myths that are out there. It's really important that we all understand that people are afraid, and then try to give them accurate, fact-based information so that they can make good decisions for themselves. Next slide, please.
There's a few more, Beth, that we can read off if you'd like.
Okay, go for it. Yeah, go ahead.
There's one, many people say that their immigration lawyers told them not to apply for any public benefits. Another one is they say that the changes happen with the changes of administrations, and the fear of it being counted. It looks like people are less scared after the change of government. Another one is some people have been afraid to apply for their children, even if they are US born. Others who have children that are not US born don't want to apply. And we have a couple more still. They're only afraid because of what their immigration attorney is advising them of.
Yeah, I kind of tried to skip over that before, but this is what I need to say on that topic. I don't. So everyone's immigration case is a little bit different, and I certainly will not tell anyone to ignore their immigration attorney's advice. But I would say a couple things. If someone is getting very, very intense help from an immigration attorney who knows all the ins and outs of their cases, then of course, then you need to listen to your immigration attorney. However, to be honest with you, I would advise, if I was talking to someone on the phone whose immigration attorney had told them not to get any benefits other than the 3 we're going to talk about in a few minutes, I would advise them to bring this material, bring our fact sheet with them to their immigration attorney and explain 2 things. Explain, I'm getting information that it is safe to get these benefits, and explain why the benefits are important to the health, safety, and stability of the family. And then ask the immigration attorney, based on this information, is your advice to me still the same? Separate from that, some people are getting very, very general advice. They're not getting individual representation, or they heard it on Facebook or saw it somewhere. Those are not good reasons to not get to avoid getting benefits if you haven't gotten very specific, individualized advice from an immigration attorney. Not every immigration attorney is keeping super up to date on public benefits and public charge. It's not usually a big part of their practice right now. It is way more important. So for that reason, I would advise people to get a second opinion, or go back to the same attorney and just say, are you sure? Here's some information I've gotten, and this is why it's so important that we have healthcare, for example. So let's keep going on in the presentation, and then we can talk about these more at the end if there's time. I do want to make sure we get you guys have a really clear understanding of what's changed about public charge before we go on. So this next slide is this is the good news. And so we put this slide kind of right at the beginning of the presentation because I think everyone needs to hear this. And this is the good news, the message that we hope that you as assisters help pass on to the people that are coming to you for help and advice. The good news is that very few people need to think about public charge now. The harmful public charge rule that came about during the last administration is permanently blocked. And so now we've gone back to using the very old and very limited public charge rule. The old rule that's in place right now affects very few people. It only applies in very few circumstances. And even then, when it applies in very few circumstances to very few people, it only takes into consideration very few benefits. And so this is just so important to share this good news with the communities that we serve. The basic underlying message is people should be much less worried about public charge now than now that the administration has changed. Basically, next slide, please. So whoops, this one is blank. Does the next one have words? There we go. Okay. So we know that the idea of public charge is confusing and it's complicated, and that it has created fear and confusion in all immigrant communities throughout this country. And honestly, I'm just going to tell you that's on purpose. It was made to be confusing and scary because the previous administration wanted people to be scared of getting public benefits. But in order to reduce that fear and confusion, it's helpful to know what is public charge. So here, the public charge is a test that U.S. immigration officials apply when they're deciding if an immigrant will be allowed to enter the United States, or if they're already here, will they be allowed to stay in the country as a legal lawful permanent resident. And the public charge test itself is when a federal immigration officer decides whether an immigrant is going to, in the future, be totally dependent on government benefits for their survival. So that's what, if someone is found to be a public charge, it's found that in the future they're likely to be completely dependent for their survival on government benefits. So I do also want to acknowledge, I guess just for the sake of context, a public charge rule in some version has been around for over 100 years. Like it's been around since the government was paying attention to immigration. So for a very long time, it's always been used basically as a racialized tool. There's no hiding that. It's been used by the U.S. government to decide who they want to keep out. Originally, it was used to keep people from China from coming to the U.S. It's been used to exclude other nationalities over time. For the past 20 plus years before the last administration, the public charge rule was pretty much the same and very limited. And then during the last administration, as most, if not all of you know, there was an attempt to change the rule. The rule did get changed and it was made much harsher. But again, I'm going to repeat the good news that the harsh expanded public charge rule that was put into place under the Trump administration is gone. It is blocked. It's permanently blocked. It is over. So now under the Biden administration, the public charge rule is back to being very limited. Only a few benefits can even be considered, and it applies to many fewer immigrants. Next slide, please. All right, so who needs to worry about public charge? It really is very few. The answer is very few people. So right off the top, there are many categories of immigrants that are always completely exempted from the public charge rule. So public charge just completely does not apply to the kind of immigrants that we sometimes refer to as humanitarian immigrants. So refugees, asylees, survivors of trafficking and violence, so T and U visa holders, VAWA self-petitioners, special immigrant juveniles, and the list goes on. So there are a lot of types of immigrants who this doesn't even apply to them ever. Also, it is really important to know that the public charge rule does not apply to people who are already LPRs, who already have their green cards, unless they are going to leave the United States for more than 6 months. If you're an LPR and you leave the US for more than 180 days and then you return to the United States, you have to go through all the immigration processes when you come back. So a public charge rule could apply to you if you left for more than 6 months and then you're coming back. But if you're an LPR, if you have your green card, you're here, you're not leaving the country for more than 6 months, you do not need to worry about the public charge rule. People who are LPRs already, lawful permanent residents, they have to renew their green cards periodically. Renewing a green card does not involve a public charge test, so people do not have to worry about that. And people who are already LPRs, they're on the path to naturalizing and becoming a US citizen. And it's really important for everyone to know that if you're already an LPR, when you apply to naturalize and become a US citizen, the public charge test does not apply in any way to that naturalization process. The public charge rule is only in the statutes that apply to someone entering the US and becoming an LPR. It can't apply to the naturalization process, so you don't have to worry about that. Okay, next slide, please. So another way to think about this when you're wondering who does public charge apply to is to understand when the test is applied. And it only applies in very limited situations. So these are the only times when the public charge rule is applied. When someone's applying to enter the US from outside the US. When someone is applying to become a lawful permanent resident, or they're applying to get a green card. And as we just discussed, if someone is already an LPR, they've been out of the US for 180 days and they're seeking to come back in. So those are the only times. And if you look at this list, you know that a lot of the people that are worried about the public charge test don't have to be worried about the public charge test because they're not applying to enter. They're not applying to become an LPR anytime in the immediate future. And they're not already an LPR leaving the US for more than 6 months. Yeah, okay, next slide, please. And then this is the other part of the very, very good news, which is now that the last administration's public charge rule is permanently blocked. The list on this slide of 3 benefits, these are the only benefits that can be considered in a public charge test. TANF, so that's temporary assistance to needy families, and that's a cash benefit for very low income families who have children, monthly cash benefit. SSI, which is it's Social Security, it's disability insurance or Social Security disability payments for people who don't have much of a work history. And then long-term care paid for by the government in an institution. And that's it. And as all of you OHP assisters are noticing, there's no medical benefits on this list. So there is not a single medical benefit. I guess you could say long-term care in an institution is a medical benefit, but I'll be completely honest with you. If you have a client who isn't an LPR yet, who's applying to be an LPR, they don't qualify for long-term care in an institution. So you don't need to work, so it won't apply to them. There's no health benefits that trigger any public charge inquiry anymore. So so that's a short list. TANF, SSI, and long-term care. Those are the only benefits considered in a public charge test. And then it's really important to note that if an immigrant who is applying to be an LPR soon, if they have citizen children or eligible children Children are eligible for the benefits that they're eligible for, and that doesn't reflect on their parents. So kids can get OHP, kids can get TANF. A parent can get TANF only for their kids. Kids can get SSI, and it doesn't reflect on the parents' public charge test. There's a very slight caveat to that, which I'll go into in a few. Well, let me just say, if a parent is not an LPR yet, and is applying to become an LPR, so they are about to face a public charge test, if their child gets SSI, that or TANF, if that's the only source of income for the parent who's an immigrant, it's possible that that could be considered in a public charge test for the parent. But for the most part, benefits that kids get never count for an immigrant's public charge test. And I want to make sure you understand something else, which is this. Even if a parent was getting TANF or SSI or long-term care, even if that was if they were getting it for their kids and it was their only source of income, that does not automatically make someone a public charge. The public charge test, when immigration officials apply it, they have to apply what's called a totality of the circumstances test. And that means look at everything. First of all, they're going to look at how long ago was it that your child, that your kids were getting TANF. And you didn't have any other source of income. They're also going to look at what's happened since then. Now your child is still on SSI, but now you have some wages, so it doesn't look like you are, totally dependent on public benefits for your survival. And frankly, I really want everyone to pay attention to this. Sometimes getting benefits like these 3 benefits, TANF, SSI, or long-term care, sometimes families need to get those benefits in order to make themselves more stable and healthy and able to get better jobs. Maybe they got TANF when one of the parents was getting a degree or getting some education or working their way up in a company so that they could get better wages. And then when they do face this public charge test, if they're one of the few people who have to face a public charge test, they're going to actually look better than maybe if they hadn't gotten any benefits in the past and they were, had health problems, they got evicted a lot, all those things that can lead to destabilization of a family. So just remember, the public charge test decides whether in the future someone is going to be primarily dependent on benefits to survive. And so if people can show they have other ways of supporting themselves, they're going to be okay. Yeah, and all of you just notice what's not on that list of benefits. Medicaid is not on there. Pregnancy OHP, not on there. Cover All Kids is not considered in a public charge test. Reproductive health benefits are not considered in a public charge test. Or COWAM, emergency Medicaid, they're all safe for immigrants to get, for immigrants themselves and for their citizen children or LPR children. Okay, that was a lot of information, I realize. Let's go to the next slide. Let's do a little review. We'll do true or false. So everybody either get a pencil and a piece of paper real fast or type into the chat whether you think these are true or false. So here we go. This is just review. This is a review quiz. People who are already LPRs, so who already have their green cards, do not need to worry about public charge when they apply to become U.S. citizens, to naturalize. True or false? So write it down, write T or F, or put it in the chat. Let's do the next one too. People who entered the United States as refugees or have asylee status do not need to worry about public charge. True or false? Give everybody a second to put T or F down. Denise, did we get any?
Yeah, so the majority of the answers for both questions were true.
Yes, okay, let's go to the next slide. Let's see the answers. True, both of them are true. Good job, everybody who put down true. You know what, I want to just clarify something and you know about refugees and asylees and most of the humanitarian immigrants, you probably all know this, but people come, for example, I'll use refugee as an example. People enter this country as a refugee, and then shortly thereafter, they do apply to become LPRs. If you entered as a refugee or asylee or anybody on that humanitarian immigrant list, when you apply to become an LPR, you don't face the public charge test. So even though refugees do go through the LPR application process, they don't get a public charge test applied to them. So everybody on that list, even though they actually do they have to apply to become an LPR, they're exempt from the public charge test. So I just thought I'd clarify that a little bit. All right, you all did great on that quiz. Let's do one more slide. Let's do one more true and false slide. Next slide. Okay. Actually, there's a couple more. I lied. All right, true or false? OHP, cover all kids, emergency Medicaid, and COVID-19 treatment, testing, and vaccination do not count in a public charge test. True or false? Jot it down with your pencil or put it in the chat. And then the next one on this same slide is SNAP, so the food benefits, the Oregon Trail Card, pandemic EBT, school meals do not count in a public charge test. Is that true or is that false? Give you a second to jot it down. Denise, how are we doing? Did we get any responses?
Yes, so for both, the majority answered true.
Awesome, great job. Next slide. Well, let's take a look at the answers. True. None of those things count in a public charge test. All of those benefits, remember, anything that's not those three, there's only 3 benefits that count in a public charge test: TANF, SSI, long-term care in an institution. If it's not one of those 3 things, it does not count in a public charge test. Okay, next slide. Let's do one more. Oops. Oh, I messed up. Okay. So actually, would you go back to the last one? Just, I'm sorry, I got out of order. So I thought now might be a good time to pause for some quick questions. We're gonna transition now and stop talking so much about public charge and start talking about benefits that are available and to immigrants and why they should get them. So right now, let's pause and have a little bit of time for questions about public charge itself, if people have them. I'm gonna turn my camera on just so you feel comfortable asking, so you're like talking to an actual person. You could put them in the, yeah, I think maybe putting them in the chat is the right way to do that. Right now, does anyone want to ask for clarification of something about public charge in particular?
We do have a couple questions here.
All right,
So
go for it.
when you say the old rule under the last administration is permanently blocked, does this mean forever or during this administration?
That's an excellent question. It's forever, and the reason it's forever is because there has literally been a change to the Federal Register, which is where rules get changed, federal rules get changed. And once something is officially in the Federal Register, it's changed. I can't say that there won't be someone someday who tries to pass a brand new rule. That's also bad, but that's I mean, it's actually hard to do that. So I mean that the Trump public charge rule that was harsh and expanded the public charge rule is permanently blocked, meaning it's gone. It's kind of erased from federal rule. Is there another question?
Yes. So what could a different president or and Congress in 2024 potentially do to roll this back? Assuming future anti-immigrant legislation gets passed, could they potentially ever look back retroactively to benefits accepted this year, even though that wouldn't be considered under current law?
Another excellent question. So let me, I think one way I could answer that is by telling you what happened when the last administration did pass or did impose a new and harsh rule. that rule was challenged by, I think, 7 lawsuits around the nation, and it was blocked on and off, not permanently until now, but it was blocked on and off because there were so many arguments that were accepted by the courts all around the country that rule varied so much from this public charge rule that has been in place for so long that it was not allowed to be a rule. They hadn't gone through enough analysis of the impacts. They hadn't shown why a vast change in the very underpinnings of the rule, why that was justified, why it was necessary. So I'm telling you that to say that it's not that easy to make a gigantic change to rules like the public charge rules. The last administration tried to do it, and they did get a rule, but it was immediately challenged, and it was successfully challenged. And so I cannot say that no administration in the future wouldn't try to change it again. I will say it's very, very unlikely that a change would then be retroactively applied to right now. That's very hard to do. It's very unpopular to do that in both just in terms of, you know, voter unpopularity, but also it's very unpopular in the legal field in terms of, like, if a judge was reviewing it, saying, is it fair to apply rules to people when the rules were completely different? It's very common for that to be found illegal. So I cannot promise what a future administration would do. I think people don't need to worry that much about it, something harsh happening possibly in the future and having it apply to now. And also, I would encourage people to remember that these tests, the public charge test, is a forward-looking test in terms of they're trying to decide, are you going to need in the future to be totally dependent on government benefits? And again, sometimes getting benefits, getting support that keeps families healthy and safe and stable actually sets them up to look a lot better when they finally do meet a public charge test is applied to them. So I think that's something important to keep in mind. But I hope that answered the question. Any others?
Just to comment that possible future harsh policy is exactly the worry people are being advised to prepare for by their immigration lawyers, though.
Yeah, I have to tread a careful line. Again, there are a lot of immigration lawyers who aren't looking very deeply at the rules. And they maybe want to take this, like, the 100% safest. Of course, like, if you've never gotten anything, then maybe who knows, then maybe there won't ever be a public charge test applied to you. But I really truly believe that is too simplistic an answer. And if someone is facing the possibility that their family is going to be evicted, or their family is going to lose a family member that has been, supporting the family because they don't have health care when they could have health care, I think it is irresponsible to not consider the importance of getting benefits and weigh those against the possibility that in the future something might happen, and that something that might happen in the future also might be applied retroactively, which is very unlikely. So I know whoever wrote that question, I know you're exactly right, and it's a big problem. We've been doing for 5 years now, we've been doing public education for immigration lawyers. Not all immigration lawyers are interested in being, finding out more about the public charge rule, but I just, I think it's important for families to make the right decisions for themselves, in consultation with their immigration attorneys, if they're working with immigration attorneys, but also really, really asking their immigration attorneys to dig in and give them advice that's appropriate for their lives right now. So I think that's about as much as I can say about that.
Thank you, Beth.
Yeah, sure. Go ahead.
We'll take one more question and then move on to the next section, just to make sure that we stay on time. But
yeah.
The question is, should people here on sponsorships not apply for public benefits? Or will their sponsors be responsible for any of the benefits they receive?
You know what, that technically sponsors are responsible for benefits. It's very rare for them to be asked to contribute. I think that's such a complicated, maybe I think that might be like a topic for another training possibly. If I can find something maybe that we could send out about it, I could forward that. But that's actually a really big question that I think would be better. You would all be better served by getting more detailed information. But in general, the same analysis applies. You know, sponsors, when they become sponsors, are agreeing to help, and they're they're signing something saying you can, I will pay back any benefits. But that it is very, very rare for people to be asked to do that. So that's just a very high level answer, but that one deserves a little bit more information. So I'd encourage like a training about that if that's something that's coming up a lot.
Thank you,
Okay.
Beth.
Sure. Okay, I'll turn my camera off. We'll go back to the slides. I think I am going to have to go a little fast through some of these next slides. You can go ahead one slide, please. Okay, so we're kind of transitioning, and we are really trying to talk to communities about So let me start again. Now that we've communicated to immigrant communities that most immigrants do not need to worry about public charge at all right now. The next step is to really talk to people about public benefits and what tell people that immigrants can they can get benefits with confidence. But the very first thing to talk about is what are public benefits and why are they important? Next slide, please. So I think some of you have had this experience, like people who are very new to this country, they may not really know what public benefits are if it wasn't something that was a concept in their country. So public benefits, we're just explaining to folks that food, health care, and other help provided by the government. But we're also letting people know that other things that are non-traditional public benefits, but they're benefits to the whole public. There are things like schools and roads and buses and lots of things that are paid for with public money from taxpayers. Just introducing that concept to people that like these are community benefits that we're all pitching in for is important. Next slide, please. And that we really believe it's important for immigrants right now to know how community resources help people. And really pointing out to folks that people's health and their safety and their financial stability is good for their own families, and it's good for the entire community as well. Next slide, please. One of the ways we're working on destigmatizing the idea of getting public benefits for immigrant communities is just pointing out all the situations in which people need to get some support. And some of them are when important life changes happen that are planned, like someone plans to go back to school and get their GED or get a bachelor's degree, or they are adding a new child to the family, and and so they need a little bit of support when their baby is young. Maybe maybe someone is moving to a new city, or maybe someone in their family is getting older and has to retire. And then there are also unexpected things that happen to everybody at some point in their life, or most people. Then those are also reasons that people get benefits, like someone lost their job, someone got sick and was prevented from working, somebody got evicted, things like that, or separating from your partner, getting a divorce. Some things like that are times in people's lives that they need to get some support, and these are good reasons to get public benefits if your family needs them. Next slide, please. So, oops, I'm sorry, this slide got a little, the spelling got a little messed up, but we're aware that some people are still hesitant to get benefits. And so we're just reminding people, and we would love for you to remind them too, immigrants pay taxes. immigrants deserve the same supports that non-immigrants get in this country, and immigrants should get benefits when they need them. They're important. Again, they can support folks in hard times, and people don't, really don't need to worry very much about public charge anymore for most of the public benefits. So they can apply with confidence and feel secure in getting them and supporting their family, like on their way to more economic stability. I wanted to point something out to the people on this webinar. You all may have good stories of people that got healthcare, got some other benefit that really helped their family weather a storm of some sort, like get them through a hard time. And it might be, first of all, I would love to hear those stories if you're comfortable sharing them, even if you don't use people's names, obviously. And then I would encourage you to share them too, and really let people know, like, this is something people do. They get health benefits, and this is the positive side of getting benefits, is that, somebody maybe caught cancer early because they were going to doctor's appointments, and instead of losing a family member, they were able to, to take care of their health problems. So I just think you have a lot of power in the stories that you tell, and I encourage you to share those good stories with people who are still hesitant to get benefits. Next slide, please. So just, we just are reminding people that immigrants are in fact eligible for benefits. There are a lot of people out there who think that immigrants just don't qualify for anything, and that's not true. Each benefit has its own eligibility criteria, and we're not going to go through every benefit that's out there and their eligibility criteria, but just it's important for people to know that some benefit programs don't consider immigration status at all. There are some where it's irrelevant what your immigration status is. And also, some families don't know that children who are U.S. citizens can get public benefits even if their parents are not eligible. And so those are just good things to share with people who are from immigrant families. I am gonna, so actually let's keep going to the next slide for now. So these are just some examples of public benefits that people might not know exist. And these are examples of things that don't require any immigration status at all. So anybody can get them. They have to be low income, but these are some food benefits. So WIC is Women, Infant, and Children. That's a supplemental nutrition program for people who are pregnant or breastfeeding or kids under 5. Guardians and caregivers for those young children can also get these WIC benefits. Food boxes from food banks and food pantries, school meals, summer meals, pandemic EBT, all of those are food resources that don't have any immigration status requirements at all. Next slide, please. And then you all know this list already. Not every group that we present to does, but Cover All Kids, COWM, emergency coverage, pregnancy, OHP, reproductive health care, charity care, and prescription drug help are all available to people no matter what their immigration status is. I think I'm going to take a minute to point out two things that I think you all already do know. The reproductive health care is really important. I think there's a lot of people who don't know that, who are from immigrant families. They might not qualify for OHP. Maybe they're about to qualify for a new Cover All People program, but that's not in place yet. So reproductive health care, like, people can access that, and that's like yearly exams and birth control and abortions are fully covered. And it doesn't matter what your immigration status is. And then the other thing that I bet you already point out to people is that if people are not eligible right now for OHP, but they become eligible because they become pregnant, they're not just eligible for pregnancy coverage, they're eligible for full OHP. And sadly, for some people, that may be the only time they have access to full medical benefits, so including dental care too. So really important, if people are on pregnancy OHP, to remind them to get a dentist appointment. It may be the only time they've had been able to have a covered dentist appointment in their adult life. So just things to highlight. And again, none of those programs have any immigration requirements. So next slide. And then there's housing help. Also, a lot of help is available irrespective of your immigration status. So right now there's the rent assistance program that is so important because it's as a result of the pandemic, people have missed paying rent. Call 211 or go to that website to apply for rental assistance. Do it right now. Do it before, I don't know when the money will run out, but I would encourage people to do it as soon as possible. And there's other housing programs. Next slide, please. Next. Oh, there we go. And then, you all know this. We're reminding people as often as we can that COVID testing, treatment, and vaccination is fully covered, no matter what your immigration status is. And then another reminder that, as with everything we've talked about so far, there's no public charge problem at all with getting COVID testing, treatment, or vaccination. So in case that's a barrier for anyone, we're reminding people too, you don't have to have an ID. You don't have to have a social security number in order to get vaccinated. Some people may ask for that, but immigrants are free to decline to give information about social security number or ID number, and there's no penalty for declining. They still get the vaccine. They still get it for free. So I know I'm preaching to the choir here. Everybody already knows that. Next slide, please. Oh, I think we're going to go forward to there. Oh, back one. There's also tax credits right now that are available. I'm going to just not go through this in detail because we're short on time, but please take a minute to read about the expanded child tax credit. You may be talking to people. If people filed their taxes this past year, they'll automatically get the child tax credit if they qualify. But if people who don't file taxes, maybe they don't have to file. There's various reasons you don't have to file. They need to know about this because this could be a gigantic amount of money for families that really need it, that they fully qualify for. If parents have ITIN numbers and they have children with social security numbers, they can get a child tax credit that could be an incredible financial help to people right now when times are hard. So please take a minute to look at that and reach out. Send people to our public benefits hotline if you'd like. We'd be really happy to advise people about that. Next slide, please. We're reminding people to apply for unemployment benefits. Now there's an online Spanish application, which there wasn't at the beginning of the pandemic. There's also numbers to call to get help in a language that you speak. So good to remind people about that. Next slide, please. And then this is a chart. This is one of the things that I'll send out by email. This is a public-facing chart that you might find helpful to hand out to people. That helps people identify like all the things they can get, even if they don't have any immigration status, or if there are things that you do need some status for, but they might have that status. We've got this in English and Spanish, and I'll send it out to you all. And feel free to distribute it, to use it. Oops, I see a typo in it. And then I'm also going to send out a much more complicated chart that is not a good one to hand out. It's just not, it's too complicated for general public use, but it might be helpful to you all to go down and just identify what people might qualify for who have different immigration statuses. So you might find that helpful. Next slide, please. Actually, we'll skip this one because we're so short on time. Let's skip, I guess let's do one true or false here. We'll just do one little quiz. True or false, children up to age 19 can get Oregon Health Plan coverage no matter what their immigration status is. True or false? And then COVID-19 testing, treatment, and vaccination is available to everyone no matter their immigration status for free. Is that true or false? I know this group is going to ace this quiz here. How'd we do, Denise? Anybody answer?
Yeah, everyone answered true.
Oh, that's so great. Good job. Well, I think we should skip the rest of these slides. They'll be sent out to you. You can keep going all the way to questions. We have some suggestions about how to apply for things, and you all happen to be like the best resource for how to apply. And then we have some tips for things to do after you apply, just to remind people that they have some obligations after they when they get a benefit. Make sure that they're reporting income changes and responding to things that the agency sends them. And then the last slide is some resources. The very top one is our public charge fact sheet. That's also a resource that feel free to print it out and hand it out to people if they're worried about public charge. That's a fact sheet they could take to their immigration attorney to say, look, there's other lawyers that are saying it's okay to get Oregon Health Plan. We really need it. Are you sure your advice to us is that we shouldn't get it? And there's some other resources on there, and again, our public benefits hotline number. And then we just have a couple minutes left, but I'd be happy to answer questions if you want to put questions in the chat about public benefits. And also, I'd like to just encourage you to give feedback on this presentation. Again, what was good information, what was helpful, what was confusing, what would you like to hear that you didn't hear about would be really helpful for us to know. So I think if you include it in the chat, then Denise and Dina can get it to me. But just in the time left, if anyone has a question. Do we have time for a question, Denise?
Yeah, there's a question. So how can a client apply for charity or drug help program?
Charity care has every public hospital in the state of Oregon is obligated to having a charity care application right on site, and they are supposed to give it to anyone who asks for it. So they'll hand you an application, or you can ask for it to be sent to you. So if someone went to the hospital and has a bill, something that their insurance didn't cover, which shouldn't be true for OHP, but certainly there are other people who have that situation. They should ask for that. And the charity care benefit, like the hospitals are required to provide more charity care than they used to be providing, based on a statute that was passed a couple of sessions ago. So that's important. The prescription drug help, actually, if you Google prescription drug help, there are some programs. I would also encourage people to call our public benefits hotline and get some information based on their locality about where people can get that help from. I hope that answers that question. Any follow-up? I'm happy to answer.
Yeah, so we've gotten some responses as well, just letting you know that this is a fantastic overview and webinar, very helpful clarification. And then responding, Googling your local hospital's name and financial assistance is the easiest way to find your local one. It runs up to 200% FPL for free and 300 partial payment in all regions. Many hospitals go higher.
Yeah, really worth telling people that if they've been to a hospital or if they need to go to a hospital to ask for that application. Well, yeah, I guess I'll just say thank you so much.
We are at time.
Yeah.
Yeah.
Good.
Thank you, Beth. It was so wonderful having you here.
You're very welcome.
A lot of good information.
I'm going to provide my email to Denise and Dina, and they can share it with you if you want to send me more feedback. I'd love to hear it, and really appreciate you all helping spread the word to immigrants about the good news about public charge.
Yeah. Thank you, everyone. Have a great day, and thank you so much, Beth, again.
You're very welcome.